Um, so could we start by you introducing yourself, just saying your name, what your job was and where you worked?
Yep, I'm Penny Cunninghame. I was a health visitor in Shetland for 30 years. I worked from 1975 to 2005. And my particular interests were obviously health promotion, because that's the basis of our job, but also because of what was going on in Shetland at the time with the building of the Solomvo oil terminal and all the sort of ramifications of that. I was very interested in the mental health of families, because it was going to be a huge upset, particularly in the North Mainland, which is where I was working, going from a sort of a fishing rural community to an industrial community.
Thank you very much. So I'll start asking questions about your professional role. So I was wondering if you could please describe the hospital or the surgery where you practiced, just giving an idea of how big it was, what kind of staff there was.
Yeah, well, when in the last few years and when I left, I was working in the Brae Health Centre, which is in the North Mainland, very near to the all the oil upheaval. And there were two GPs with their practice nurses. It was a dispensing practice, so there was a dispenser and all the usual drugs and stuff. And they had a practice manager. And in the community nursing side, there were district nurses, district nurse midwives, and health visitors, and a community psychiatric nurse. We also had a physio on site most of the time. And there were various visiting services, such as social work, a counsellor, psychiatrist, Macmillan nurses and people like that. And there were two dentists and their ancillary staff. And not least, but last, the janitor, who was very important for the whole working of the place.
Can I just ask, could you describe what a health visitor is, what that means?
Well, basically, it's somebody who has done her registered general training, nurse training, and then has gone on to do various other things like obstetric training or midwifery, and a health visitor diploma or a degree now. And you're basically it's health promotion within the whole family. So it's a huge generic thing. And it all depends a lot, your specialities depend a lot on where you're working, your particular interests and things. So working in Shetland, it was wonderful to me anyway, because we had fairly free reign. I mean, we couldn't go mad, but we could focus on what we were interested in, and we were very well supported.
Thank you very much. So could you describe a little bit about your usual working routine? So your working hours, your commute, and the sort of numbers of patients that you'd see every day.
Okay, well, that's not very easy in some ways, but the commute was interesting. When I first started working, it was about a 20-minute drive or something to my base. But towards the end, it was about a 1-minute drive or a 3-minute walk. So it just varied depending on where I was living. The basic health visiting hours are usually 9 to 5, Monday to Friday, which sounds really cushy. But we also did quite a lot of evening sessions and evening visits, because, if people were working, then you had to go during the day to see them and stuff like this. And the sorts of things that we did, I can't really tell you the number of people I saw a day, because it just depended on what I was doing. But we did things like drop-in clinics for child health. So they were in the health centre or in local schools, because it was more convenient for the parents. School health promotion I did a fair bit of. Antenatal and postnatal groups. The antenatal groups were with midwives, so that was really good. And sometimes they were in the evening as well. Positive parenting groups I ran. And obviously home visits, because, being a health visitor, you have to do the home visits. And sometimes with other agencies, such as social work or the community psychiatric nurse. And there was a lot of, well, quite a lot of interdisciplinary case conferences for one reason or another. And also visits to nursery schools and playgroups, you know, as needed, as directed by the staff there. I think that's about it.
Thank you very much. So are there any particular challenges that you faced which you think are unique to or more common to people who work in areas like Shetland?
Well, the two that sprang to mind immediately were the weather and the geography, and they both were worked together because it really made life quite difficult at times, especially in the early days, because we used to get cancelled ferries, so there were no stocks in the shops. Electricity failures, so everything would go down. So we had a generator at the health centre. So those two things really had a huge effect on every aspect of life. And so there were a fair number of mental health problems due to these various things, people feeling cut off. I'd like to say now that a lot of the people that I worked with were incomers, in that they weren't the people who were used to Shetland. So that's why some of these things were exaggerated, because they were just had been uprooted and put in this pretty remote spot. The cost of living was more expensive, especially petrol. So that could cause a problem with families. And you could feel very isolated up there, the workers and the families themselves, the people themselves. And from a personal point of view, the lack of anonymity when you were actually working and living in the same district, that could be a bit of a problem. People would pin you up against the baked beans in the shop, you know, and say, I haven't heard about the so-and-so, because that could be a problem. And you had overlapping roles as well, so that could be a bit difficult with confidentiality, you know, because I was a mum as well as a health professional. People would, you know, expect you to be able to tell them, or want you to tell them certain things which you obviously couldn't do. And then pre-IT, before we had computers and things, the communication within the islands and with the islands was a bit of a problem. Yeah.
Thank you very much. So for the sort of challenges you faced, have you seen any particularly interesting or innovative solutions to some of these sort of particularly Shetland challenges?
Yeah, I find this one a bit difficult. I worked an awful lot. You had to be really good at interdisciplinary working. So I worked an awful lot with the community development people from the social work department and the local authority. And one of the things that we did was up in Firth and Mossbank, we had one of the council houses, and we opened it up as a community house, whereby a lot of other agencies could go in and be sort of on the doorstep for these folk who lived up there. Things like the CAB and the social work and health promotion and myself and the other visiting services that I mentioned, the CPN and things, so that it was more accessible to the folk, which was really, really important, I think. I don't know if that's still ongoing. I mean, things have changed a lot since then, I should think. And one thing that was ongoing while I was up there was they were raising money because of one of the things that we're going to be talking about in a bit, the travel out with Shetland for patients. They were raising money for a CT scanner for the Gilbert Bain Hospital, and they raised an awful lot of the money locally, which is always very impressive. And that's being used now. I think it was installed in 2007.
Thank you. So other than working in Shetland, have you worked elsewhere? And can you kind of compare that work with Shetland work? Are there any sort of obvious differences in the way that hospitals are run or systems were adopted at all?
Well, we're talking about quite a long time ago. I trained and worked in London before I went up to Shetland. So in some ways, well, it was just easier and quicker to get access to everything when you're down there, which you take for granted. What else did you ask me?
Just essentially, what struck you as the differences between, well,
Oh,
working in London
yeah.
and working in Shetland. So, is there anything that sort of stood out, or particularly? You're allowed to say no.
Oh no, this is the main thing was I thought I was prepared for it when I went up there. I was all sort of jolly, I want to live on a Scottish island and all this sort of stuff. But it was really, I suppose, the feeling of isolation. Because when I first went up there wasn't a health centre, so you worked from home or via the GP's surgery, which was in his house. So I mean, it was a very sort of intimate sort of thing, and that again was hugely different. But not, one coped with it. You had to. But that's about, I mean, it was just enormous, the differences.
Thank you. So, are there any particular medical complaints which you think were more common in Shetland than elsewhere?
I don't know in particular. I think the things that really affected part of my work anyway were drug and alcohol dependence and depression because of the isolation and the strange situation that some people found themselves in. But I don't know about actual physical health problems.
That's fine. Thank you very much. So, without giving away patient names, can you think of any examples of particularly challenging cases that that the isolation and the geographical location of Shetland might have contributed to?
Well, it was very interesting that when I first went up there, local people didn't believe that there was anything such as child abuse or child neglect in Shetland. We're all a big community and stuff, but in fact there was quite a lot. And I think partly, and it wasn't always from incoming families. And I think partly it was because of the sort of rural isolation, which might well happen in all rural areas. The Shetland's the only rural area I've ever worked in. But I think this really, was a huge part of the problem.
Thank you. Oh, sorry.
So, sorry, I was just thinking that there was one particular case of child neglect which was brought on by alcohol abuse, and it was very difficult to deal with because you had the community as well as the family to deal with. So that was when real sort of support from other agencies was very, very helpful. And we did work pretty closely, which was very important.
Thank you. So, moving to the patient's experience of this, do you think there are any particular challenges which your patients faced in Shetland? So, receiving treatment, continuing treatment, or just staying healthy more generally?
Yeah, well, I think one of the big things was the transport within Shetland and outside Shetland. So it was very difficult for some people to actually access the medical services that they need within Shetland. But when it came to seeing specialists and having specialist treatment, they basically had to travel to Aberdeen, which, is quite a long way. It's quite upsetting, especially for some of the older people who'd hardly ever been off the island. And it was very sort of traumatic for families because there's only general surgeons in the local Gilbert Bain hospital. So they could deal with a lot of things, but obviously some things and some therapy had to be done on the mainland. And you needed to use your car a lot. If you were lucky enough to have a car, you needed to use your car a lot, and therefore a lot of people, myself included, didn't get enough exercise because you just got into your car, went somewhere, got out again. So that meant that we weren't actually doing an awful lot of physical exercise. Some of that was addressed when the leisure centres were open, but that's another matter.
Thank you. So this one might be a little dated. So I want to ask you where you look for information, training and professional support, but obviously you are retired, so presumably the sources are not Facebook and email. But yes, if you could sort of, I guess getting an understanding of what training you got at that time to support you, and what did you have any particular sources that you turned to for useful
Yeah,
information?
yeah. Well, this was an interesting. This is an interesting question. We had local resources. So, as I said earlier, I think we were very well supported for our needs. We had local sources. So we had visiting specialists who would give of their time, like the clinical psychologists and paediatricians, who would do training sessions with us if it was anything we particularly wanted. And there were other local people who lived in the area, and we were given suicide prevention training and counselling diploma training and things like that. So that was really helpful. The Robert Gordon, which was a college and is now a university, they provided quite a lot of support as well, and training. And in particular, I did the nurse prescribing course and the practice supervisors course there. And that was, some of it was distance learning, but a lot of it you actually had to go to the to Aberdeen for that. IT, as we said earlier, the introduction of IT has made a huge difference to us. Locally, we were supported very well by our peers. So we had regular health visitor meetings with guest speakers, which was very valuable especially for the people who lived on the outer islands, because they could actually get together with us and see, and swap stories with us and see what was going on. We were encouraged to attend the health visitor conferences on the Scottish mainland, which again was really valuable. And our then nursing officer, encouraged us when we wanted to find out more about initiating new services. So that was very helpful. So you didn't really feel as though you were on your own a lot of the time, and yeah. And also, she supported me in my Open University studies, which was very, very useful.
Thank you. So before we move on to the other questions, which I was going to ask you, which are more to do with the sort of almost the political side or the bigger picture, I wonder if we could ask or focus a little bit more on your medical work. So the population of Brae, the town in which you are working, is around 700. And I was wondering, obviously, as a health visitor, you went out and visited people. Sort of how far afield did that cover? What towns in your area were you visiting?
Okay, if you're talking about the district that I was sort of employed to cover, because I did actually do quite a lot of relief work. That's the biggest town. The other ones are Firth and Mossbank, Vidlin, Nesting. I suppose you'd call it a parish rather than a town. Vaux. That was just about it. And then there were sort of what used to be an island, Muckle used to be an island because there's a bridge there now. Yeah.
Thank you. And other than sort of working in that area, you sort of touched on that you were filling in or covering for other people. I was wondering if you could describe a bit about the other places that you worked within Shetland.
Yeah. Well, you had to be pretty flexible when working up there. So it's quite a small workforce. So if anybody was on holiday or off on a long time sick or something like that, somebody had to go and do the work. So I used to go to most of the Shetland mainland I worked on, which obviously involved going to different health centres and surgeries and getting to know the GPs in these various areas. The island of Yell and Unst, I did a little bit of health visiting in, but I also went to a couple of non-doctor islands a few times because, and that was really not much health visiting. It was more being presence of a nurse. So I did district nursing there. So that was interesting. So there was Fuller, which is off the west coast of Shetland, and Outskerries, which was off the east coast of Shetland. And they were very interesting experiences, very different, even more rural. Yeah.
So taking, for example, Fula that you mentioned. So Fula at the moment has a population of 56. Could you describe a little bit roughly how long you were there and what type of duties you had?
Yeah, right. Well, I was there each time I was there for about 10 days or 2 weeks. And the duties were not onerous. I mean, a lot of it was actually being there, but certainly because people were interested in the fact that it was a new person coming in, we used to get invitations to go and see folk, and Mrs. So-and-so would like to see you and all the rest. And a lot of it was socializing with the people, and showing them sort of support. It was interesting in that none of the times that I was on the non-doctor islands was there ever really a crisis. So I was pretty lucky in that. But, obviously we received a little bit of training before going out as to what to do if there were any sort of real emergency. Yeah.
Thank you. So were your experiences on Outskerries quite similar to Fula, or were there any differences that struck you?
I have to be very diplomatic about this. The people on Skerries are very different to the people on Fula. Skerries is a very, very open, friendly island. Whereas Fula, although they welcomed you into their homes and stuff, there was just a little bit of reserve there because I think they were more suspicious about folks. I think they got fewer visitors there. But yes, Skerries was lovely, very, very nice. And there was a proper nurse's home there, a nurse's house there, which, certainly on my second visit, there was a purpose-built nurse's house with a surgery. So that was interesting. Mm.
Thank you. So now I'm going to ask about your sort of broader views on medicine in places like Shetland. If there are any questions that you don't have an answer for or don't want to answer, just say no or pass or whatever, and I won't press you on them. So the first one is, are there any particular skills which you think remote practitioners in places like Shetland need that should be sort of looked for?
Well, I think one thing definitely, and I think I mentioned it earlier, is flexibility, to be able to sort of put your sort of professional hand to almost anything. Because, sometimes you are on your own and you have to sort of do various things, which I might not have been, I wouldn't have been doing in London. And therefore you need a lot of self-reliance and self-confidence and very good communication skills, because people are the same the whole world over, and it's not, you have to be, again, diplomatic and able to get on with folk to get anywhere. You also need, I think, a sense of adventure, the fact that this is new, this is different, and that never really left me, I don't think, while I was, all the time I worked up there. And another important thing, I think, is to be motivated to retain your skills and to keep up to date with things and to try and improve. Yeah. And there used to be such things as triple duty nurses when I first went up there, but there aren't any anymore. I think the last one retired just after I'd retired. Who were general nurses and midwives and health visitors. And they really did the old cradle to the grave family care, which was really valuable, but things move on.
Thank you. So, and this again, given that you've been retired for a little while, you may not have thought about. So, but do you think there are any current or future events which will have a big impact on medicine in places like Shetland? So, examples being Brexit or potential Scottish independence.
Oh, I'm not sure I'm able to comment on that sort of thing. I mean, one thing that Brexit is going to make or possibly going to make a difference to within the community, which will reflect possibly on the healthcare, is something which worries a lot of the people up there, and that's the fisheries, because it's, although the oil was hugely important and still is important within Shetland for employment, fishing has always been pretty high up on the agenda, and even at the moment there are problems with the flow of things, and plus the sort of political side of the actual fishing. So I think people are really worried about that, thinking that maybe this is going to lead possibly to a bit more depopulation. Who knows? But I can't really comment on other things.
Thank you. So this one, I think, was probably a problem when you were working as well as now, so you might have an opinion on it. But do you have any comments on particular issues which, places like Shetland face in terms of the recruitment and the retention of nursing and other medical staff, and the use of locums as well?
Well, I think that's always going to be a problem in any remote community. Getting, people who really fit into the community, who will stay, and it's really difficult. I mean, a lot of the people that I worked with actually were Shetlanders, even the GPs. I shouldn't say even the GPs as well, who'd obviously been away, done their training, done had a lot of experience away, and then come back home, as it were. They obviously were going to be more likely to stay than folk like me, who went up there, out of context. But that is going to be a huge problem, and I'm not sure how they're tackling it. It either suits you or it doesn't, basically.
Thank you. So I'll sort of, I'm close to wrapping up now, you'll be pleased to know. But do you think that practitioners, whether nurses or doctors in areas like Shetland, have the sort of support and the voice that they need? I mean, are they considered as much as they should be when new legislation is being passed or decisions are being made?
I would imagine not. I think they just feel a bit out on a limb. However, I think there are groups who get together from various rural communities, nurses and doctors and other medical staff, who can support each other and be a bit of a louder voice within things. But I mean, it's like a lot of things, where the big population is, that's where the decisions are made.
Thank you. So my last question, are there any particular changes or improvements that you would ideally like to see? If you in a dream world where money was limitless, what do you think would improve medical provision in places like Shetland?
Oh, well, if money was limitless, you would have a lot of the specialities actually on your doorstep. You'd have a more modern hospital, which they are looking into because it's not really fit for purpose, the present one. You would just have everything so that people didn't have to go to leave their families and go to Aberdeen, to the mainland, or further afield sometimes. That would be an absolute ideal, which will never ever happen. It just can't, because there's no such thing as a bottomless purse nowadays, especially at the moment.